This week's Ask Dr. Durie comes from a patient who has been watching the news and has seen indications about generic forms of medicine being available for the treatment of multiple myeloma. And so the question is it okay to take a generic form of medicine? Well, the good news is that when these generic medicines become available, they have to be approved by the FDA. And this is rather a rigorous process. And so in general, the generic medicines can be considered to be safe and really equivalent to the original brand medication. Obviously, large studies have not been conducted with the generic form of medicine, but in general, it should be largely equivalent. Recently, it was announced that a generic form of Revlimid, generic lenalidomide, was going to be available. And so now, instead of Revlimid, there is the option for generic lenalidomide. And then there is also available generic forms of Velcade, bortezomib, and so bortezomib by intravenous injection has actually been available for a few years now, and here recently, by subcutaneous shot, bortezomib is now available. And so we have those medications potentially available for myeloma patients to consider. What are the pros and cons? Well, potentially one of the advantages is that the generic could be cheaper, could cost less. However, the pricing is really quite complicated, and at this moment, it's really hard to say in an individual case, depending on the status of Medicare or private insurance, if there is or will be advantages in terms of cost for individual patients. And so the very good news is that both patients and doctors, certainly for the time being, have the ability to select, will they continue with the brand Revlimid or Velcade or switch to the generic lenalidomide and bortezomib. And so that choice is there, and lacking a particular cost or other advantages, most likely there's no really strong reason for a majority of patients to consider switching, but to perhaps just continue with the brand that they may have been using for quite some time, possibly years. So the bottom line about generic medicines is that it is extremely important to talk to your local doctor about that and see what are the pros and cons in your exact case. In most instances right now, chances are it will be feasible and recommended just to continue with your regular brand medication. But things will evolve over time, and we just need to stay alert to any updates in terms of news related to costing or any other issues. But good to know that there is that option there, but you don't need to immediately jump over to that generic formulation.